we'll sort of run it from there. But you guys can go ahead as a double duo, so go for it.
Yeah, I'm happy to kick off though, but I'm Sharon Sanga. I'm the registered manager of a care home for people learning disabilities and a supported living service as well. Equally, I'm on the board of the Berkshire Care Association. We represent the whole of Berkshire as we work as volunteers, and we want to raise the standards and awareness of our sector. So we support providers, a lot of independent providers, to excel in what they do. We give the support in our specialist areas. So mine is learning disabilities, and we will help people with anything and everything really. But equally, I run my own organisation, which is a service for people learning disabilities. And I guess both Cliff and I are here to just raise awareness of what our sector can offer as well. Cliff, I don't know if you want to kind of give a bit there.
Yeah, thank you, Sharon. Good morning, everybody. Yeah, I mean, as it goes for me personally right now, I'm the director of Larchfield House, and it's a specialist nursing home for people living with dementia. But as Sharon has alluded to, we both sit on the Berkshire Care Home board, and my history also sort of transcends probably everybody on this call. I've worked in the NHS as various roles, but finally as a turnaround director, turning around acute hospitals, but equally the private sector, and also running hospitals and fertility clinics. So I think that's the message for everybody to understand, that the skills are transferable, and you can work across sector, and it's really important that you don't get yourself closeted with respect into a certain mindset, because there's lots of opportunities out there. You're all very skilled people and very valued people, so you'll be welcome anywhere in the sector, to be honest. So it's just looking out and listening to what opportunities are there. And believe me, you know, of all those things that I've done, running a nursing home is probably still one of the most challenging job roles I've ever had. I mean, we're quite a big home. We're best part of 100 beds, and we just purchased a new one close to that as well. But the point is, you have to be hands-on with everything. Now, that sounds quite intimidating, but it's not. It can be a lot of fun as well. But there are roles within every organisation that I am sure your skills will slot into. So just please be aware that, you know, it's a good industry to work in. And without health and social care, I think we can all agree that it would put more pressure on our colleagues in primary care and in the hospitals. And we're already seeing those pressures, regardless of the pandemic. It's all over the news. Everybody's stretched, and it will continue to be that. So there are those opportunities out there, but please, you know, feel free to ask questions. Don't be afraid to ask questions, because they're great opportunities. I mean, as we've alluded to, we're part of the Berkshire Care Home Association. I've got a list of roles that are currently available, which I can share after the meeting today, and we can disseminate that around. But it will give you an idea of the roles, but don't just think that they're, because there's clinical roles, there's non-clinical roles. But every role that you are currently doing, I can guarantee you, will be available in the health and social care, 100%. So please feel, I mean, like I said, we'll share that with everybody. It's a very rewarding job as well. You know, it's no different with respect to what you've been doing for a very, you know, a sustained period during the pandemic. So don't be afraid. The salary is quite good as well. The hourly rates are quite good. You might be surprised. Sharon, have you got anything to add?
I was just going to say, yeah, I agree with Cliff, what he was saying about in terms of transferable skills, but also we do all have our own career pathways as well, because I think often people may just sort of associate the social care sector as just caring for individuals and supporting them, but equally you can excel in the sector. I mean, it's known to happen where people can start off, say, for instance, as a support worker, and then a team leader, and into management, and you can do that within like 2-3 years if you're dedicated and you have that passion. And as Cliff is saying, it's such a rewarding sector. You're making a difference in someone's life every day. No day is the same, and that's what we enjoy the most. I think when we say challenging, it's just the fact that you go in and you don't know what you're going to face, but fact is it is so enjoyable. And especially any role really, because a lot of it is taking care of be it directly or indirectly people who need that support. So yeah, I mean, and like I said, we're happy to answer questions in our sort of niche sectors or just generally about the social care sector. Thank you.
Thank you for that, Sharon. Thanks, Cliff. I mean, there's clearly what I'm hearing from this, lots of opportunities that you've got. They cover a breadth of areas. And one of the questions that I've got, just learning myself, is do you provide training for anyone who may not have the prerequisite skills? Are there sort of introductory sort of courses or things that people should be doing, or is that all provided when somebody actually comes and speaks to you?
Yeah, thanks, Laura. No, I mean, every provider provides full training. So you can come in as a raw recruit. As long as you've got the appetite to fulfill the role, then you're showing all the skills that, how can I put this? If you're a compassionate human being, then that's really all you need, and the commitment to carry out the role. All providers will provide full training. I mean, I've got, strangely enough, there's a picture going on our website today where I've got 57 of my employees here signing up for NVQs, but I've also got 16 others that are doing nursing degrees as well. And they all came to me as, with respect, people off the street that had that desire to be working in health and social care. So it's not, you know, and the nursing is happening at New Brookes University, so it's reasonably local as well. There's a lot of on-job training. NVQ, yes, there's some online training to do, but most of it's in the workplace. So it's not as if you're really putting yourself out, and supernumerary time is given for that training. So, you know, all the costs are covered. So it's not, you know, it's a really positive career pathway to take up if that's what your desire is.
And can I just add, actually, it's not just as like what Cliff has described in terms of nursing or kind of doing the NVQs. You can even become very specialist as well. So we have dementia specialists in our organizations, or behavior specialists, or sort of champions in terms of safeguarding or medication. So there are so many different roles that one can be trained up and acquire. And if someone has that background, but again, it's the sort of, we will tailor it to our services because it has to be bespoke, it has to be person-centered. So yeah, equally, we're much smaller compared to Cliff, but we will equally drive people to progress and develop, and of course we'd want them to stay with us forever, but at the same time it's all about raising the standards across board. So that's what all of us providers endeavor to achieve.
Thank you, Sharon. I couldn't agree more. I think it's all about upskilling. It's about enriching our population and building those skills, whether it's within our own organizations, within the system, or just generally for the local population and any industry that's neighboring us. I've got one more question before I open it out to everybody else to ask, and that is the flexibility of the roles. Now, everybody that's come in to the vaccination program so far, they've all come in, they've got a bank contract with our lead provider, Frimley Health Foundation Trust. What's the flexibility of the roles? Because that's really been one of the key successes of the vaccination programme in terms of providing that level of flexibility for all the willing people coming forward.
Yeah, I mean, yeah, the same applies. I mean, I know Sharon does this, but most providers will. The flexibility is normal because, with respect, everybody that's on this call that potentially could be looking for a role is no different to the people that we've currently employed. So they've got family commitments, they've got child care issues that they need to have every Tuesday off or whatever. Everything is considered and nothing is not on the table. It's about communicating with what your requirements are as the applicant and what the business needs are. And I can honestly say that it's like a jigsaw, but it's no different, I'm sure, to what you've been doing at Salt Hill. Its flexibility is key because we couldn't have the committed teams that we do if we weren't flexible and looking to support them. And let's face it, you know, Sharon, I know, has got a family, so she's got to look after all those things. I've got a family, so we're no different. So we understand. So it's everything is on the table, everything is possible. It's as simple as that.
Thank you, Cliff. Now, it's not just a three-way show here. So if anyone has any questions, you know, there's a button you can put your hand up, or if you want to speak, please speak, and we'll sort of go through you one by one. So don't be shy. This is a safe environment to ask any question. The floor is yours. Or silence. Is it too early?
Hi, can you hear me?
Yes, we can.
Yeah. I've just posted it in. So I've got Riz here with me. We both work for East Berkshire, doing the reception at Salt Hill, and I also work as a healthcare assistant administration for Frimley Hospital. Now that this is sort of coming to an end at the end of August, I suppose we're interested to see, we're both looking for bank staff workers, admin. So is there an email address? Is there a list of jobs that we can go to apply?
So you're looking for where to apply and where those jobs can be found, right?
Yeah.
Okay. Cliff, Sharon, I believe you said you've got a list of roles. Can you share the roles and any website that the applications can take place via, or any contact details for any of our, you know, staff that are on the line today to drop you a line and understand more about those roles?
Yeah, I mean, I've got a list of roles here, and we're still, as the Berkshire Care Association, canvassing all our care home owners, managers, directors, etc., to pull that list together. But I'd gladly share this after to you, Gaurav, to disseminate between everybody. But equally, as much as we can provide that, I would encourage everybody, if you live in a certain location and you might have transport issues, you might not drive, whatever, it's simply just contact people. You know, nobody's going to throw you out by having a phone call saying, I'm looking for a role, because you happen to be half a mile away and I can walk there, or have you got any roles? Everybody will have roles, but we will share emails. What we'll also do, Sue Dorling from the Care Association, who's an employee of the association, where me and Sharon are, we're just members, and we're members of the board. Sue will be able to pull more information together and disseminate any inquiries to potential clients with your permission, because we don't want to start pushing your CV into areas that might not be suitable. But Sue's will be happy to do that, no problem whatsoever.
Thank you. Mohammed.
Yeah, hello there. Cliff, for some reason your volume seems to be very, very low. And Gaurav, my question to you is that, is it only existing staff members can apply here, or is it new staff? Because my wife wants to apply as well.
We're encouraging as many people. So obviously this session was set up for everyone who's already on the books at Salt Hill.
Okay.
But that doesn't discourage anyone outside of that to,
Okay.
I'm sure Cliff,
Fair enough.
Sharon, others will welcome, people applying from all walks in or out.
That's fine.
There's a question, I think, just looking in the chat box, from Primla, which says, sorry, had issues connecting this meeting. Mr. Stark, can you give a summary of the roles available and possible upskilling? Does this include any clinical skills? So Primla, if I'm not wrong, and correct me, Cliff or Sharon, but if, all the training that would be appropriate for the role that you'd be applying for would be provided, by the relevant organisation. So Berkshire Care Association, the relevant, the care homes, Sharon, Cliff, and others who are part of that would all make sure that you are safeguarded with the correct level of training before you undertake the role that you do. Happy for you to jump in and correct me otherwise, but is that sort of broadly the right answer, Cliff?
Yeah, 100%. All care providers are obliged to give you the appropriate training for their job. It's all free of charge. There is no charge for that. But equally, as mentioned earlier, I'm just speaking a bit louder, Mo, because normally I'm well heard. So apologies if you're not hearing me well. But no, I'm just trying to think of an example. If you're doing an admin role, which is a very valuable role, but you want to progress into a more clinical career pathway, then you've got to consider what you want to do. But for example, I know Sharon does it, I know we do it here at Larchfield, but many other providers do. If you've got no clinical experience whatsoever, but your aspiration is to be a nurse, then you will get that opportunity. You can join as a carer. You'll do some levels of MBQs. And I say that is because that will confirm that you want to do the role and that role is suitable for you. But it's also a prerequisite. If you're going to New Books University to do a nursing associate course or a nursing course, they will look for prior experience. So an MBQ, if I'm honest, the lowest level can be done if you commit yourself within 3 months. We have people that fly them because they want to progress their career. So you could get that out the way and you could be signing up, onto the next intake at New Books, for example. Other universities do obviously apply to this as well, but New Books is the common one for us because it's close, and that's the reason.
Thank you, Cliff. Are there any other questions with regards to Berkshire Care Association and the roles and the conversation that we've had this morning with both Sharon and Cliff? Sheena.
Yes, hello, good morning. So I applied for Salt Hill and I was on the onboarding process and I never quite got over the line to actually work in Salt Hill. I'd initially applied to Surrey because I live in Surrey, but I live quite near Frimley. So are there opportunities? I take it there's no mutual thing with Surrey Health Trust. This is just purely Berkshire that we're talking about. But are there opportunities that are sort of near Frimley or near the borders rather than having to go in deepest, darkest Berkshire? Because obviously for my travelling commitments, that would be quite difficult for me.
Yeah, hi Sheena. The simple answer is yes. When we say we're the Berkshire Care Home Association, that is correct. But we're also linked to all our adjoining colleagues in other associations. So for sure, if you want something closer to, whereabouts in Surrey are you, Sheena?
I'm actually in a place. I'm in a place called Elstead, which is about 6 miles from Guildford.
Yeah.
Quite near Farnham.
Yeah, no, exactly. I know it well. I used to live in Hook, Sheena, so it's not a million miles.
Yeah.
But
No.
but yeah, absolutely. I mean, we would gladly share some contacts again after the call, which could be shared to other care associations that's local to you. There's no problem in that. And I can guarantee you there will be opportunities, Sheena, and everybody, because health and social care is growing all the time. The need is obvious. People are living longer. I know, I mean, we're registered for younger people, and I know Sharon is likewise. But health and social care generally covers a very, very broad spectrum. It's not what people assume it to be as a residential nursing home for people 75 plus. It is not. I mean, I've got a young person's unit here, and we've got 7 people with Down syndrome and dementia. So, you know, that it's not. It's very broad, and I will reiterate that every skill that's that's needed. It's not just about care. You need admin, you need finance, you need IT specialists, you need hospitality, you need housekeepers, you need maintenance. Everything that you need in a hospital exists in health and social care.
Okay, lovely. So would you be able to then pass me some details, or when you circulate the details, you'll pass me some for Surrey as well?
Of course I will, Sheena. No problem at all.
All right, smashing. Thank you very much.
You're welcome.
Thank you, Sheena. Good question around geography, and I think that will plague quite a few people who at the moment are travelling into Salt Hill, into Slough, and are looking for opportunities that may not necessarily be central, but some on the periphery or in other areas that are co-located to the Frimley footprint. So really good question. Well, I'd really like to thank you, Cliff and Sharon. Sharon, if you just bring yourself back on the screen so that we can just say thank you to you formally. But I think it's a great effort, and you know, where we can do as much linking as possible. And you know, though you're here today, you know, we really want you to be present and part of the whole process. Salt Hill is closing at on the 26th of August, so we've got several weeks ahead of us of where we're really constantly trying to make sure everyone understands what's available, and this is the beginning of that journey. So thank you so much for being part of this.
Can I just add that we will have representation from the Berkshire Care Association in the following weeks when you have these sessions. So I think that'll be really good. And I know that maybe some colleagues couldn't attend today, but they might be able to spread the word. And I think Sue Dorling, who her details were on the chat anyway as well, she's probably the main person to get in touch with, who can probably disseminate these vacancies as well. But equally, we're happy to share our contact details. I'm sure Cliff is as well, directly, because like I said, I'm sort of more learning disability, mental health. Cliff is nursing, dementia, a mixture clinical as well, non-clinical. Ours is completely non-clinical, but yeah, there are many opportunities.
Thank you, and we will disseminate what we receive. So we'll provide that, and obviously once everyone gets your details, they're free to contact you directly and build those relationships and hopefully progress into some fruitful careers within the industry. So thank you. Okay, Sheena, I can see your hand up again. Is this for Sharon?
No, apologies if it's up. It's a mistake. I do apologize.
Oh, okay, no, it's okay. I'll just I think it's still up from before. It's a legacy hand, as they say. Okay, well, moving on then in the agenda, perfectly on time. I think just the other way around. We've now got. I'd like to welcome Jane Blacklock. Jane, you'll do the introduction on yourself far better than I can. So, welcome to the session. I've seen you join, and you've heard what Berkshire have spoken about. The show is yours.
Yeah, well, I think Berkshire have covered it really pretty well, haven't they? You know, it's the same at Frimley. We have a requirement for our on our bank and permanently for staff to join us at all times, and that's across admin and clerical, finance, IT, nursing, healthcare assistants. So I think I've seen quite a lot of notes go into the chat with my email address on. So you're more than welcome to email me if anything is of interest to you. We have a wide range of roles, as I say, and if you're interested in finding out more about joining the bank, then I will put you in with the relevant person, put you in touch with the relevant person, whether that be our clinical lead or our admin and clerical resourcing specialist. So yeah, I think, you know, the roles are very similar. So, you know, it's just about where works for you. Obviously, we have Heatherwood in Ascot, Frimley Park in Frimley, Wexham Park in Slough, and then we have a unit in Bracknell and some in Aldershot, Farnham Way. So it really depends where you live and where works for you.
And I guess, Jane, just building on some of the questions that we asked earlier as well, you know, just for the benefit of everyone around on this call, you know, what's the kind of flexibility that's offered for these roles? Because that's a real key component, you know, for some of the staff who have been forming the vaccination program.
That's quite tough, actually. I mean, obviously, if you come in as a healthcare support worker, then it's quite easy for you to select the shifts that work for you. That if you're on bank, then obviously you select a shift that works. But with admin and clerical, it tends to be the reliance really is very much around full-time working. We have a lot of requirements for Monday to Fridays, there is quite a lot of full-time opportunity. There is occasional part-time, very rarely weekends in admin and clerical, but occasionally part-time, but it would normally be a 9 to 5, 8 till 4 type position.
And in terms of the application process, everyone was shared what we're terming the menu of opportunities earlier this week on Monday. Within that, we sort of put together a pathway for everybody to follow should they be interested in any of the admin and clerical pathways or roles that you've got.
Yep.
Now, just to reiterate and go through that, for again the sake of everyone, I guess the first step in that is to provide their CVs across to you. Is that correct?
Yeah. So I've had a few through already. I'll try that again. A few through already, which I forwarded on to Sarah, and hopefully she's been in touch with you to talk to you a little bit more about the roles and what you're looking to do. She will then be able to onboard you. She would just take a few extra details from you, which would include your national insurance number and your date of birth, so that she could add you onto our internal system. That will then start an onboarding process for you, whereby we'll invite you to an interview, and then if you're successful and it works for you and it works for us, then we would onboard you onto the trust to become a member of the bank.
Fabulous. And is there anything else? I mean, I know we've touched on admin and clerical, but probably to give some idea of what that might mean in terms of an actual job on the ground. What are there any examples of what those roles or where those roles present within the organisation?
Well, at the moment, I've got requirements for reception at Heatherwood, which is Monday to Friday. I've got requirements for finance, doing basic financial admin calculations. So anybody who's got a finance background, we've got a few roles in finance at the moment. We've got outpatients roles where it's working and booking outpatients appointments for patients. So there's a wide range of opportunity across all of the directorates within the trust, really.
Super. And I guess I've asked all the questions again, but does anybody else have any questions for Jane? We've got her here. It'll be really good if you could sort of utilize this opportunity. It will be for the benefit of everyone. So over to you.
Hi Jane, it's Primla here.
Hi.
I'm bank with both East Berkshire and Frimley. So with Frimley, I'm a HCA plus a HCA vaccinator now.
Yeah.
So what sort of roles would be available? And I guess the vaccination for the outreach is still going to be available.
Yeah,
and what sort of other?
that doesn't actually come under my team, so that comes
Okay.
under the ICS. So although you're under a Frimley HCA vaccination contract, if you were to join, are you on the bank with Frimley as a healthcare assistant?
Yes, I am.
Yeah, okay, so that contract then still stands, so you could book into bank shifts as a healthcare assistant already at Frimley, if you've got that contract currently. If you haven't, then we would, if it is through the ICS, although it says Frimley, but it's through the ICS, then we would need to create a new contract for you.
Okay, that's fine.
Yeah.
And again, would there be training if you wanted to do other things? Because with the vaccination, is there opportunities to do other clinical skills?
Not really.
Or is it just HCA?
Yeah, the vaccination, we don't have a requirement for the vaccination skill within the trust.
Fabulous. Any other questions for Jane?
Sheena?
So Sheena, do you want to go first?
Yes, hello, sorry. Yes. I was just wondering, with the bank work, is that all clinical work, or is there opportunity, because I don't have nursing skills, is there opportunity for other work? Because I was looking at getting the job, I haven't quite started it yet, but I was looking at the admin side of the vaccine role. So now, from what you're saying, it looks more like I would be in line for the admin and clerical type work, but I was quite keen to do bank work. Would there be any opportunity?
Yeah, so that's what we were talking about. Bank admin and clerical is normally Monday to Friday between 8 and 4 or 9 and 5.
Right, but those are full-time roles, so you can't just.
The nature of bank is that, particularly in admin and clerical, the nature of bank is that you can't come in one day and not the next. The admin and clerical requirement is normally because there's an overload of work, or there's a long-term sickness, or there's vacancies. Yeah, so it's really, admin and clerical bank is an opportunity to pick and choose an odd day's work as and when you want to work it. It really is committing to a requirement within the trust for a period of time.
For a period, so you might suddenly need somebody for like 3 months to cover maternity leave or something like that.
Yeah.
Right,
yeah.
Sorry, I misunderstood. Thank you.
Yeah, okay, no worries. Patricia.
Hi, Jane. I was just going to ask if, I know Cliff offered in terms of Berkshire that he would send out a list of available vacancies, and you mentioned a few, and I didn't get a chance to write all them down. Is it possible to kind of share it with Gaurav or with us to just see what's available?
But I could share with you today what's available, but that doesn't mean that it's available tomorrow.
Okay.
Yeah, because obviously the nature of the work is that we need to fill it as quickly as possible. So if you were on the bank, then you would be given, you'd be contacted with roles that came up. And then if you were interested, you could speak to the manager and ascertain whether it worked for you and it worked for them, and then, come to an agreement about fulfilling it. But sending a list it's not something that is, as I say, it's as good as the minute it's sent, but no good after that.
Okay, thank you.
Yeah. Okay.
And in terms of just building on that, so probably you'd recommend looking at having that conversation with you first.
Yep.
So the whole CV to yourselves, you will then have that conversation or stroke interview with the candidate, talk about the suitability of, you know, matching whether the requirements fit the commitment, and then beyond that go through the onboarding process. And you'd sort of recommend that process other than going to the site itself and looking at the vacancies that are on the various.
Yeah, so we don't tend to put our bank admin and clerical vacancies on online.
Okay.
It doesn't really work like that, but you'll find lots of permanent vacancies, admin and clerical, and nursing, healthcare assistants, you know, wide-ranging permanent roles for Frimley that are always advertised online, but our bank requirements don't come up online.
Okay, and I guess that's why I was so keen on having a session like this, where it's not just signposting everyone to a jobs board to say, go to this jobs board and look for the jobs. I think it's really important everyone hears from yourself and the opportunities that you've got that you may not see in those fora. So, you know, the fact that you've just mentioned that the bank admin and clerical roles aren't posted there is a prime example of the benefit of a session like this. And just again reiterating that, you know, get your CVs together, get them over to Jane, and the process will start from that point onwards. And hopefully it's as simple as that. Any other questions for Jane? Or Jane, is there anything that you haven't covered that you think is important that some of the staff should know?
Yes, sorry, just to answer Kelly's question, there's no, and in admin and clerical, there aren't as and when it suits shifts. Yeah, for healthcare assistants, yes, there are as and when it suits shifts because you can book yourself in and out. But for admin and clerical, that doesn't happen.
Thank you.
Okay.
Okay, well, if there are no more questions for Jane, I guess that pretty much will draw this session to a close. As discussed earlier with Cliff and with Sharon, now with Jane, any information that we get, we will share not just with this group, but with the wider pool of vaccination staff. And any questions that you have, whether it's a follow-up on this session, details for Jane, Cliff, Sharon, and any other names that have been mentioned will be shared. So you're more than able to contact them directly. But where we can help, we will facilitate. And I just want to say a massive thank you to all our presenters today to talk through the opportunities. I think this is a really, really critical phase of not just the vaccination programme, but us developing our maturity as our newly formed integrated care boards as well. So, you know, just showing the fact that we'll all work together, we'll all harness the strength of our own efforts. And, you know, I think this is a testament to the way that we're going to work going forward. So thank you so much. And then even more importantly, to everybody who's joined and made the effort to join the call today and show that willingness to take these steps, to take the next step post-August, and hopefully stay within our system and for many years to come. So thank you so much.
Thanks a lot. Cheers. Bye-bye.
Bye-bye now.
Thank you.
Thank you.
Thank you.
Thanks.
Thanks, everybody. Goodbye.
Goodbye.
Thank you. Goodbye.